Hello, my name is Cynthia. I'm a student in the Master of Healthcare Administration program with Phoenix University for MHA capstone, MHA 599 capstone, November 2021. This is an SBAR of the current condition, recommendation for the current condition, severe acute respiratory syndrome SARS, that has infected 55 million worldwide, and as well as 1.3 million deaths has occurred since 2019 to 2021. The current healthcare system of America, United States, is a hybrid with a single payer system with private insurance mandates. The clients as well are able to pay out of pocket in America. With that being said, there are a number of Americans that have no access to healthcare, even though there are insurance by the federal government. So the triple aim of healthcare is to improve the experience of healthcare, improve the healthcare population, reduce the per capita of healthcare. The current crisis of COVID, SARS-2, severe acute respiratory syndrome, which causes the coronavirus, which has killed, recap, 1.3 million plus humans have been killed by the coronavirus worldwide. So currently we are in a pandemic. The current crisis of COVID-19 has inundated the healthcare system. The number of bed occupants in New York had quadrupled, which is of course an issue for which it further exacerbates the issue of airborne pathogens, SARS-2, which makes it harder for people to get individuals to get better care. And as well as one of the issues we have currently is healthcare professionals. Of course, in New York, we had the 202.10 executive order to extend scope of practice so that there will be more people coming to New York and provide health care. But we do have the bed occupancy issue. So looking at Schenectady, which is a small community county in New York of 153,739 individuals, we find that in August 3rd, 2021 alone itself, that there were 15,000 individuals who were reported infected by the SARS-2 COVID-19. So now the recommendation is obviously to have more clinics in more hospitals. So this is something that is very difficult to achieve briefly. So the best thing where we cannot set up hospitals that fast, but clinic are more likely to respond to the issue. So the best recommendation I have is to increase clinics by a factor of 10 per areas. So with my assessment, I find that if we were to have a plan as such with waiting areas which can have oxygens with plexiglass, which the CDC mandated, or a healthcare office must have plexiglass, and people must be 6 feet apart, then we will have save a lot of lives. Again, the small clinics could be as small as big as a 6,240 square areas, which for occupant 30 to 50 people. So with that, we will have an area for where the individuals, the clients, can off 10 bed, which this will be every 2 hours that they could get oxygens and oxygen care, corticosteroid, hormones, and vitamins as well, and x-ray lab, including in the mobile clinic, alongside oxygen chairs. It will have a nursing station and waiting area for the non-COVID client that can also get oxygen. So one of the issues with COVID-19 is respiratory. There's a lot of people that have that does not have oxygen but may have asthma. So we want to separate the clients that has asthma with the client that does not have asthma, and we will not want them to be affected by frequently going to the hospitals. So the best thing is to have those mobile clinics and those urgent cares, which can lessen the amount of visit per clients to the hospitals. So with COVID-19, we have the issue of blood hemolysis, and that is also relevant in Evans syndrome, which is the disease, another disease of the COVID-19, which further shorten the lives of the clients even more, because you only have 1 to 8 years to live. So this is also very important issues, because those people who are more affected are males, as we know that males are less likely to go to the doctor. It's connected to one of our issue is that access to healthcare, having healthcare insurance itself. So this is something to the mobile clinic can offer is insurance. So speaking about why did I pick Schenectady? Schenectady is live 20% of the individuals are under the poverty line, which is 5% more than New York itself. So we have a great issue with access to healthcare. Secondly, the other reason is that Schenectady itself has been inundated by COVID-19, and is relevant for people to have healthcare access in their neighborhood, in front of their school, which is more convenient to them than getting to the hospitals, as the hospital themselves is inundated. And Schenectady only have one healthcare system, which is a non-profit, Alice. It has only 3 centers, include a woman health care center. So we don't have enough bed in Schenectady, New York. So this is the reason why I picked this. As far as treatment, what was very relevant to clients who has that disease is vitamins and medicine and getting oxygen. And a lot of people that have asthma may think that they should get nebulizer, and because of oxidation we cannot do that. So the best thing is to have the clients come in and get oxygen, get medication, and have referrals. And the small clinic are able to do that, and the small clinic can run on a sustainability efforts, solar panel, which will reduce the amount of utility costs. So that will decrease the amount of costs that the client, the individual units are accruing a year. So with that being said, this is my SBR, and thank you for listening. Because my accent. Okay.